influenza fever or flu. It is an acute, contagious, seasonal respiratory disease. Usually occurs in winter season and is caused by the influenza virus, which consists of various strains, mainly A, B, and C viruses. Mostly, the influenza symptoms are produced by the virus A and B, which are very severe ones. Mode of transmission is droplet infection. The infected person, during the process of talking, sneezing, coughing, and spitting, expel the virus in the air. That is why it is called as airborne. And the healthy person in the vicinity, especially within 2-meter range, they catch this infection. The viruses travel through nose, mouth, into the respiratory tree, which consists of nose, nasopharynx, buccal cavity, larynx, trachea, bronchus, and bronchioles, and ultimately the air sacs or the alveoli, which are the very important unit of the lungs for ventilation. That is absorption of the oxygen and exit of the carbon dioxide from the blood. The incubation period of the influenza is 2 to 3 days, while the infections remains from 1 week to 2 weeks. Usually and normally, when the attack is moderate, influenza viruses fades away on its own, provided the immune system of the person is healthy and strong one. When these viruses get entry in the respiratory tract, they multiply and increase in their number and power. Due to this action, the immune system of the body come into action and try to destroy the pathogens. As a result, the release of the cytokines produces inflammation of the respiratory tract, bronchioles, bronchi, and alveolar sacs, which are filled up with the exudate and in some ultimate and dangerous in critical stage into the pus formation. Another mode of transmission is contamination of the articles of the infected person, bed sheets, pillows, utensils, mirrors, shaving apparatus. When the healthy person touches these articles, they get infected with the virus, and when they rub the hands to the mouth, nose, and eyes, and the virus get entry. So always avoid close contact with the infected person. Have a distance of 2 meters at least. Wash the hand frequently. Use the mask for the healthy attendants and also the infected person or the patient. So isolation is compulsory for the infected person for at least 7 to 10 days. Mostly children under 5 years, elders above 65 years, pregnant women, immune compromised persons are more prone to this infection and victim of this seasonal disease. The symptoms produced are very severe, producing torture to the patient, severe headache, watering of and reddening of the eye, stuffiness of the nose, sore throat, dyspnea, breathlessness, bone pains, muscle ache, nausea, vomiting, malaise, and the general fatigue symptoms. The prevention is better than cure, and there is no permanent cure for this viral disease. So, hygienic hypotheses and steps are compulsory, and basic ones: primarily washing of the hands, wearing of mask and gloves, taking the distance, safety distance of at least 2 meters from the patient, isolation of the patient, ventilation of the and insecticide spray in the patient room. For the children, nebulization and steam inhalation to the elders and the children, especially under 5 years age. Vaccination. Vaccination is not a cure for this disease, but it boosts up the immune system of the human body to kill the viruses. So, annual shots of the influenza virus is given to all age groups, children above 6 months, and overall the younger ones and the elder ones, male or females. This vaccine consists of 2 types: inactivated or the dead virus vaccine, live attenuated vaccine, in which the virus is live but has been inactivated or they have been sterilized, or their virulency has been reduced to the subclinical level, that they do not produce any harm in the human body. So annual shots of the vaccine is necessary for all age groups and all groups of genders. Now it is a notable thing that symptomatic treatment consists of acetaminophen, ibuprofen, anti-allergic, antitussive, the cough suppressant, elixirs and syrups, and antiviral drugs and medicine. But aspirin should not be given to the younger children under the age of 11 or 12 years, because it produces Ray's syndrome, which is very dangerous to the liver cells and the neurons of the brain. In medical treatment, you have to first do the diagnostic tests like blood smear, culture and sensitivity test to detect the strain of the virus and superadded infection of the bacteria. If there is bacterial infection also along with viral one, then you have to choose the proper antibiotic like cephalosporin, 3rd and 4th generation, quinoline groups, ciprofloxacin, moxifloxacin to kill the bacteria. Normally, in the very severe cases, we adopt antiviral treatment regime. So influenza fever is though very harmful and produces very torture to the patient, but it is a curable and it not produces any fatality of the life.